directly from the company too, but they don't sell it at the drugstore. And so this isn't a cure, but it helps and it works. So for people who have, so we went over just the water part. So now you have the most common type. That is, your oily layer is not very good. Then we got to do things to clear up and make your oily layer better. So one, if you have all that stuff on your eyelashes and blepharitis, we have to treat that. So that means scrubs, cleaning your lashes off every morning. And then we have a foam that has antiseptic stuff in the foam you can put on and rub on your eyelashes at bedtime. And then hot compresses. So with blepharitis, we treat with hot compresses, and with meibomian gland disease, because the glands are in your lid, we treat that with hot compresses too. So we have two options on hot compresses. You can take a washcloth, put it in hot water, and keep going back and forth to keep it hot. You can try putting a wet towel in a microwave, but you got to really be careful that you don't burn yourself. Or this is some goggles we found, and so this company makes these goggles, and they have little gel beads inside of it. You drop them in a cup of water, microwave for 45 seconds, put them back in, put the goggles on for 10 or 15 minutes, and you're done. So this is an option. Or you can do the hot compresses with a washcloth. It really doesn't matter as long as you're doing it. So then we have another drop. And actually this drop, we're out of it at the moment. This drop has become so popular, and this is the same company but not the same drop, that we have this is the only oil-containing, lipid-containing teardrop preservative-free on the market.
What's the name?
It's called Retain MGD. Same thing, you're not going to get it at the drugstore. This company is fairly small. They only sell it through specialists who are dealing with dry eye like I am. They only sell it through a doctor's office. And so it has been working, it's been helping people tremendously. So it has the oil in it, and it has no preservatives, and it works really well. So we can treat a lot of meibomian gland disease. If you have the blepharitis, we treat that. And then if you don't have that, then we put you on the pills, hot compresses, and this special drop that's now back ordered for the next 2 or 3 weeks. They've sold it out. They can't keep it in stock. Those three things will make almost everybody better. If it turns out that you're just really severe and you're unhappy and you really need relief, and your lipid layers are really bad, then there's nothing that's going to make you get a lot better until you clean those glands out and help them work again. And the only thing we have is the LipiFlow. And so I don't push people to do LipiFlow. I go through this, and I even a lot of times tell these three things, and I tell people, we'll give you a couple of months, and if you improve a whole lot and you're happy and you want to sit tight, you can. We'll just stay the way we are. But you have to know that every so often you're going to close off a gland that's not going to come back. So, and we don't do a lot of treatments. We probably do 2 or 3 a week, not a lot, because the thing is that, as other people were asking earlier, the LipiFlow is not covered by insurance. That's the biggie. So if it was covered by insurance, there'd be a machine on every doctor's office in the United States. It's a $100,000 piece of equipment. It was I thought long and hard for a long time before I bought it, because are there enough people who have severe enough dry eye disease are going to pay me $1,600 to treat their eyes with this machine that's not covered by insurance? And it turns out there's enough that I'm paying for my payments, and we're making a tiny amount of profit. But we're having people I have eye doctors drive from Tampa to me to get treated because they have dry eyes and they know the machine, they know it works. They're just not spending $100,000 on the machine in their own office. And so it's a big decision. And it's probably never, unfortunately, going to be covered by insurance. Even though it's FDA approved, the company, and this is, I can't tell you if it's true or not true, but the company has told me that the apparatus you saw that goes in the eye, they charge of the $1,600, $800 goes back to the company. Plus, they got to pay for the machine. They're telling me that little apparatus is handmade, expensive to make, and so they were scared to death if they went to Medicare and said, we're now FDA approved, we want a procedure code for this treatment, and we want you to pay for it, which Medicare would have to do because it's now an approved procedure, that they would come back and Medicare say, okay, the doctor fee for this, including the cost of the apparatuses, is $349. Well, they're charging me $800 to begin with. So they're scared to death that the price will be so low from Medicare insurances that they'll have no company. They'll have no way they can do business. So they're never going to ask them to cover anytime in the foreseeable
Is
future.
that just a one-time treatment?
So
or series?
hopefully it's a one-time treatment that's going to last for a pretty good while. I think with the treatment, with the maintenance of doing the hot compresses, taking those pills, and doing that special oil-containing drop, that you're going to have it last a long time. That's been my experience. So far, since June, no one's come back and said my eyes are getting worse. But in the study, there were a few who did, but in the study, they weren't allowed to do anything what I'm telling you to do. They weren't allowed to treat their blepharitis, they weren't allowed to do anything, because when the government studies something, they want just the machine involved in the process and nothing else. So, there are all kinds of ways of treating dry eyes now. We have a whole 2 pages of things that we offer people. I even have put a lady on testosterone drops and cream to her eyes, because there's 2 or 3 studies that show that in postmenopausal women, which is the biggest group of dry eye patients, that there are testosterone and estrogen receptors on your eye, and that controls how your eyes produce tears and function. And so there are a few doctors who are treating dry eyes with testosterone cream. So we do that some on a rare occasion too. Yeah.
Can you sort of get a handle on whether a person has a certain type of dry eye just because it's only in one eye, or is that more common to have it in one eye or more common to have it in both eyes?
It's usually worse in one eye than the other. Not equal, and just like the one I showed you, the LipiFlow, it was 90 on one side and 55 on the other. So you're going to have different symptoms in the 2 eyes.
And can you, have you ever done studies if a patient reduces the amount of sodium intake, that would have any effect?
They have no effect.
No effect.
Because, like I said, if you took a tablespoon of salt a day, you're going to swell up like a balloon, but your body's going to maintain. If you did a blood test, your salt level's still normal.
Right. And it wouldn't have any effect.
Won't have any effect on your, because the reason you have a high salt level in your eye is your tears have evaporated off, and minerals and all the other particles can't fly up in the air. They get left behind. So your eye becomes hyperosmotic from the tears evaporating away or from or low production. Yeah?
Does allergies and like red tide and pollens and all this have an effect on the glands?
The red tide might, just because it's going to cause inflammation. Allergies can too a little bit. And the company that makes does the salt level is working, and maybe in a couple of years they'll have a test for allergies too, because you can measure. I had an old machine that would measure the IgE levels in your tear film. And so if we can measure that, then we can know exactly how much of your irritation is from allergies, because your IgE levels would be elevated. And if they're not elevated, then it's all dry eye. So eventually we'll get to the point where you can measure which one is which. Now, typically with allergies, it's seasonal. That is, my eyes start burning one in the spring or in the fall or whatever it is. And dry eyes all the time, it's a little worse in the winter because the air's drier and there's windier in the winter here. So you have, but those symptoms are usually worse when you're outdoors because the wind's blowing. So I have people say, I get up in the morning and take my morning walk, and my eyes are watering all the time while I'm walking down the street because their eyes are, and I say, your eyes can't be going to water. They're drying out, and then you're crying as you're walking down the street. Now, people who have Sjogren's don't sometimes do as much of the watering because their lacrimal gland is affected as well. So they don't cry as much as someone with regular dry eyes, because not only is the regular gland, other glands not working, their lacrimal crying gland's not working either. Yeah.
Does sinus have anything to do with it?
Sinus trouble just can cause general inflammation around your eyes, but there's been no study to show that per se. Yeah.
Is the rheostasis effective?
Yes, for the right people. I have some people, and I've had some people who just says, that saved me. That worked fantastic. So I do have a lot of people on rheostasis. So we have a larger armamentarium to treat dry eyes with now. So that's one of them, plugs are one of them, the pills, the drops, specific type of drops, hot compresses. I mean, there's a list of things we can do now to make people feel better. In the back?
Have you ever heard of laser treatment to your eye that would clean?
It's not this, that the laser treatment, which is IPL and pulse light treatment,
Yes.
has never been shown in a study to be effective. And so there are some doctors using it and promoting it, but it's not passed FDA scrutiny as of yet, and that it works. It's more painful because you're really you're doing a laser skin treatment that is burning your skin, and at the same time hoping the heat penetrates down to the glands, and it has not passed FDA approval. Yeah.
Would drinking more water or other fluids help reduce the salt concentration?
Not the salt, but it may help you produce a little more liquid. And, you know, and that is, so you recommend people to drink a lot of water, but I can't tell you that that does a lot, but there's no harm in doing it. Yeah?
I would take it there's no danger to your vision or anything with the LipiFlow.
No, it's all protected
Just
and
external.
it's fine. Yeah. Yeah,
If you go to your ophthalmologist every 2 years, like they tell you to go.
right?
Do they check for dry eye syndrome or?
They look.
Oh, do
I
they
mean-
tell you that?
Well, I mean, you can look.